Assalamu alaikum everyone. I am Dr. Ahmed, lecturer of Pathology Department, Bashundhara Medical College. Today I would like to present to you a small presentation of the topic the heart. Today we will know first of all the congenital heart disease, which is the congenital anomalies of heart. Congenital heart disease refers to abnormalities of the heart or great vessels that are present at birth. The most severe anomalies are incompatible with life. On the other hand, defects affecting the discrete regions of the heart or individual chambers can be compatible with live birth. Most of the various structural anomalies in congenital heart disease can be organized into three major categories. 2. The major functional abnormalities they cause: left to right shunt, right to left shunt, and obstruction. So first of all, we'll know what is shunt. A shunt is an abnormal communication between chambers or blood vessels. When blood from the right side of the circulation flows directly into the left side, which is the right to left shunt, it causes hypoxemia and cyanosis. The pulmonary circulation is bypassed and the poorly oxygenated venous blood shunts directly into the systemic arterial supply. Emboli from the peripheral veins can bypass the lungs and directly enter the systemic circulation. The diseases in the group causes cyanosis early in postnatal life, which is called cyanotic congenital heart disease, which are the tetralogy of Fallot, transposition of great arteries, tricuspid atresia, and persistent truncus arteriosus. The four cardinal features of TOF are VSD, obstruction of the right ventricular outflow tract, and aorta that overrides the VSD, and right ventricular hypertrophy. Left to right shunts are the most common congenital heart disease. This includes ASD, VSD, and PDA, and these lesions result in chronic right-sided pressure and volume overloads that eventually cause pulmonary hypertension with reversible of flow and right to left shunt with cyanosis. Now we'll know what is ischemic heart disease. Ischemic heart disease represents a group of related entities resulting from myocardial ischemia, an imbalance between myocardial supply and cardiac demand for oxygenated blood. More than 90% of cases, myocardial ischemia results from reduced blood flow due to obstruction of atherosclerotic lesions in the epicardial coronary arteries. Consequently, ischemic heart disease is frequently referred as coronary artery disease. Ischemic heart disease can have the following clinical presentations, which is myocardial infarction, angina pectoris, chronic ischemic heart disease with heart failure, and sudden cardiac death. Which is the pathogenesis of ischemic heart disease. The dominant causes of ischemic heart disease syndromes is insufficient coronary perfusion. Relative to myocardial demand, in the vast majority of cases, this is due to either of the following. 1. Chronic progressive atherosclerotic narrowing of epicardial coronary arteries, and 2. Acute plaque changes, thrombosis, and vasospasm. What is chronic vascular occlusion? A fixed lesion obstructing more than 70% of vascular cross-sectional area is typically cited as the threshold for systemic ischemia precipitated by exercise. Means it will occur when the patient does any kind of exercise. An obstruction of 90% of cross-sectional area of the lumen generally leads to inadequate coronary blood flow even at rest. Slowly developing obstructions includes the formation of collateral circulation that can migrate the effects of even high-grade stenosis by allowing alternate channels to perfuse at high-risk myocardium. Then what is acute plaque change? The risk of an individual developing clinically important ischemic heart disease depends in part of the number, distribution, structure, and degree of obstruction by atherosclerotic plaques. Acute coronary syndrome, which is unstable angina, acute MI, and sudden cardiac death, are caused abruptly by acute plaque changes. These acute coronary syndromes are typically initiated by an unpredictable and sudden conversion of a stable atherosclerotic plaque to an unstable and potentially life-threatening atherosclerotic plaque or lesion through rupture, superficial erosion, ulceration, fissure, or deep hemorrhage. which is collectively called the acute plaque changes. That's all for today. Thank you.